When it comes to men's health, few topics are surrounded by as much confusion, discomfort, or silence as prostate cancer. It's a subject many men avoid. It's not something we often hear discussed over dinner or in locker rooms, and because of that, it often becomes a blind spot ignored, misunderstood, or pushed aside until it becomes impossible to ignore. But the truth is undeniable. Prostate cancer is the most common non-skin cancer in men. In the United States, it affects 1 in 8 men during their lifetime. For African American men, the risk is even higher, and yet, so many men never talk about it, never ask about it, and never get tested until the disease has advanced. And like some cancers that strike fast and loud, prostate cancer often develops slowly, quietly, over years. And that's both the danger and the opportunity, because while prostate cancer is common, it's also one of the most treatable cancers when caught early. When detected in its early stages, prostate cancer can often be managed with minimal disruption to daily life. In many cases, treatment may not even be immediately necessary, just careful monitoring. But the key is this: you have to catch it before it spreads. And the problem is, in the beginning, prostate cancer doesn't always cause symptoms. Or if it does, they're often so subtle that men chalk them up to aging, stress, or just getting older. The result? Too many men don't know they're at risk. Too many men don't know what signs to watch for. Too many men don't get tested until it's too late for simple solutions. And that's why we're here. Not to scare you but to prepare you. Not to overwhelm you but to give you the tools and clarity to take charge of your health on your terms. In this video, we're going to walk through why early detection of prostate cancer is so important, what signs you can watch for, how to respond if you notice something unusual, and what steps to take without fear or embarrassment. Because being a man isn't about staying silent. It's about being smart, being aware, and taking care of yourself and the people who count on you. You don't need to be a doctor. You don't need to understand every medical detail. You just need to know what matters and act when it counts. Let's talk about why early detection of prostate cancer could save your life or someone else's. There's a reason why doctors talk about prostate cancer screening, and it's not to scare anyone. It's because when caught early, prostate cancer is one of the most manageable forms of cancer. Let's make that clear. This isn't a death sentence. It's a challenge that, when identified early, can often be monitored, treated conservatively, or removed with excellent results. In fact, many men diagnosed early live long, full, and completely normal lives after treatment or without needing treatment at all. So the question becomes, why do so many men miss their chance to catch it early? Because prostate cancer doesn't always knock loudly. It doesn't always cause pain. It doesn't always disrupt your life in the beginning. And that's the tricky part. For years, it might grow without any obvious sign. You might not feel sick. You might not look sick. You might go to work, take care of your family, and live your routine without the faintest idea that something is developing in your body. That's why routine screening and early awareness are essential. For most men, screening begins with a simple blood test called the PSA test, which measures the level of prostate-specific antigen. It's fast, affordable, and widely available. It doesn't hurt. It doesn't require a hospital. And yet many men skip it out of fear, embarrassment, or simply not knowing they should. Some may think, if I feel fine, why should I get checked? The answer is simple: because by the time you feel it, it may already be serious. Early detection gives you options. It gives you time. It gives you control. And in many cases, early-stage prostate cancer doesn't require surgery or aggressive treatment. Some men simply monitor the cancer over time with regular checkups, a process called active surveillance. This means fewer side effects, no hospital stays, no disruption to your work or personal life, just informed decisions with your doctor, your family, and your future in mind. But all of that is only possible if you catch it early. Late-stage prostate cancer, on the other hand, can spread to the bones, bladder, and lymph nodes. It becomes harder to treat, more painful, more invasive, and more emotionally draining, not just for the patient, but for the entire family. So ask yourself, would you rather face a small issue now or a life-threatening one later? Would you rather take 15 minutes for a test today or fight for months in the future? Would you rather live in silence and wonder, or know the truth and take action? Your health is not something you gamble with. It's something you respect, protect, and prioritize. By getting informed and staying alert, you give yourself the best possible outcome. You keep the door open to easy, early treatment. You keep the power in your hands. Next, we'll walk through the most common early signs and symptoms of prostate cancer so you know exactly what to watch for and when to act. Because when it comes to your health, waiting to be lucky is not a strategy. Paying attention is. One of the most challenging aspects of prostate cancer is that, in its early stages, it may cause no symptoms at all. That's why routine screening is so important. But for some men, Subtle changes do appear, and if you're paying attention, those signs can be the wake-up call your body is trying to give. Let's walk through the most common early warning signs of prostate cancer. 1. Frequent urination, especially at night. One of the earliest symptoms men notice is the need to urinate more often, particularly during the night. If you find yourself getting up multiple times after going to bed, and this is new for you, your prostate could be the reason. The prostate sits just below the bladder and surrounds the urethra. When it begins to enlarge or develop a tumor, it can press on the bladder or urethra, leading to this constant urge. 2. Weak or interrupted urine flow. Are you having trouble starting or stopping your urine stream? Is the flow weaker than usual? Or does it stop and start multiple times before you're done? This is a classic sign that something may be affecting your prostate's control over your urinary tract. 3. Difficulty urinating. Do you ever feel like you can't empty your bladder completely, or that urinating takes longer than it should? This feeling of hesitancy or straining could indicate a blockage or pressure caused by prostate enlargement, and that includes cancer. 4. Pain or burning during urination or ejaculation. Any unusual pain or burning sensation when urinating or during ejaculation is a red flag. While it might be due to an infection, it can also be a symptom of inflammation or pressure from the prostate gland, especially if it persists. 5. Blood in urine or semen. Even a small amount of blood in your urine or semen should not be ignored. This symptom doesn't always mean cancer, but it always deserves a doctor's attention. It's a clear sign that something abnormal is happening in your urinary or reproductive system. 6. Erectile dysfunction or decreased sexual function. While it is common for many reasons, a sudden or worsening problem with erections, especially when accompanied by other urinary issues, can be an early symptom of prostate cancer. Changes in libido, performance, or ejaculation may also occur if the prostate is affected. 7. Discomfort or pain in the pelvic area, hips, or lower back. If prostate cancer spreads, it often affects nearby areas first, like the pelvic bones, hips, or lower spine. Unexplained pain in these areas, especially deep, dull, or constant aches, may suggest that the cancer has moved beyond the prostate gland. 8. Pressure or heaviness in the rectum or perineum. Some men report feeling a pressure in the area between the scrotum and the anus called the perineum, or a sensation like something is pushing against the rectum. This can be caused by a growing prostate pressing into nearby tissues. 9. Swelling in the legs or feet. In more advanced stages, prostate cancer can affect lymph flow and circulation, leading to swelling in the lower extremities, often beginning in the ankles or calves, though this is not an early sign in most cases. If it occurs along with other symptoms, it's important to investigate. 10. A gut feeling that something isn't right. Sometimes, the most important symptom is the one you can't explain. You just feel off, tired, sluggish, like something in your body isn't working as it used to. You may not have pain, you may not see blood, but you know your body may be trying to tell you something. Remember, not every urinary issue means cancer. Most men will experience prostate growth as they age, a condition known as benign prostatic hyperplasia (BPH). But here's the key: if the symptoms are new, getting worse, or affecting your quality of life, don't ignore them, because if it is cancer, catching it early gives you the best shot, and if it's not cancer, you'll still get answers and relief. In the next section, we'll talk about how to respond if you notice one or more of these signs and how to take action without panic or delay. So you've heard the signs. Maybe one or two of them feel familiar. Maybe you've been waking up at night to use the bathroom more often. Maybe you've noticed a slower stream, or a little discomfort that wasn't there before, and now you're wondering, could this be something serious? Let's pause right there before you let worry take over. Here's what you need to know. Most prostate issues are not cancer. In fact, the majority of men who experience urinary symptoms are dealing with benign prostatic hyperplasia (BPH), a non-cancerous enlargement of the prostate that comes with age. Other causes might include infections, inflammation, or even dietary factors. So no, these symptoms don't mean you have cancer, but they do mean it's time to take a closer look. And the good news is, you can act right now, without fear. Step 1. Track what you're feeling. Start by being specific. How often are you urinating during the day? At night? Is the flow slow, hesitant, or interrupted? Are you experiencing pain or burning? Have you noticed any blood in your urine or semen? Write it down. Even a few notes on your phone can help your doctor see patterns more clearly. Step 2. Make the appointment. Call your primary care doctor or urologist, a doctor who specializes in the male reproductive system and urinary tract. Be honest. Don't hold back or feel embarrassed. Urologists see these symptoms every single day. This is normal conversation for them, and their only goal is to help you stay healthy. And remember, asking questions doesn't make you weak. It makes you wise. Step 3. Get the right test. Your doctor may recommend a digital rectal exam quick, painless, and over in seconds. A PSA blood test to check levels of prostate-specific antigen, possibly an ultrasound or MRI. Depending on the findings, none of these tests are difficult. None of them require surgery, and most of them take less than an hour. The earlier you get tested, the more control you have over the next step. Step 4. Stay calm whatever the result. If the tests come back normal, that's peace of mind. If something is slightly elevated, your doctor will monitor it or run further tests. And if cancer is found, it's far better to find it now, while you still have every option available. No matter the outcome, you'll have information. And with information comes power. Talk to someone if you're nervous. Talk about it with your partner, with a friend, with your doctor. This is not just your fight. Your health affects your family, your future, your ability to live freely. So don't delay. Don't wait for things to get worse. Take the first step now while you're strong, clear-minded, and in control. In the next section, we'll bring everything together with a clear, motivating message, a reminder that you can take charge of your health without fear or shame. Let's move forward with confidence. By now, you've heard the facts. You know the signs. You understand how prostate cancer can quietly grow without pain, without warning, and still change everything if it's not caught in time. And maybe, for the first time, you've realized, this could happen to me, or to my father, my brother, my friend. That awareness, that moment of clarity, that's where real health begins. Because here's the truth. You don't need to be afraid of prostate cancer. What you need is to be informed, prepared, willing to act before the problem gets out of hand. There's no shame in asking questions, no weakness in getting checked. In fact, it takes real strength to say, I'm not waiting for a crisis to take my health seriously. You've got too much to live for, too many people who count on you, too many things you want to do, build, explore, and enjoy. You can't do any of that if you're ignoring your body. You can't live fully if you're living in denial. So here's the message, plain and simple. Don't wait, don't guess, don't stay silent. Speak up, get checked, follow through. And if something is wrong, you've caught it early. You're in control, you have options. If nothing's wrong, you've gained peace of mind, and that alone is worth everything. Health doesn't mean perfection. It means awareness. It means action. It means doing what you can today so that you're still standing strong tomorrow. Because you are not just protecting your body, you're protecting your purpose, your relationships, your future. And if you think no one's watching, you're wrong. Your kids are watching, your partner is watching, your friends are watching. Let them see what it means to take responsibility. Let them see what it means to lead with courage. Let them see that strong men protect their health, not ignore it. You've got this. Now let's finish with one final step, because knowledge means little if it's not shared. If this video opened your eyes, helped you understand your body better, or gave you the courage to think seriously about prostate cancer, don't keep it to yourself. Share this video with the men you care about. Your father, your uncle, your husband, your brother, your best friend. You never know who's silently experiencing symptoms or who's been too afraid to ask the hard questions. Send it privately, post it publicly, talk about it. Sometimes, a simple video is the push someone needs to take action. Leave a comment below. What was new to you? What questions do you still have? Have you or someone you know dealt with prostate cancer? Your story might be the voice another man needs to hear. Subscribe to our channel. This is part of our Cancer Awareness series, where we dive into the most common cancers affecting people today, sharing signs, prevention tips, and early detection strategies that could save lives. If this content helped you, like this video so that YouTube can recommend it to others who need it. In our next episode, we'll be exploring colorectal cancer, what makes it so preventable, and what signs you should never ignore. So go ahead, hit the notification bell so you don't miss what's next. Most of all, take the next step. Make the call. Schedule the checkup. Start the conversation. You're not doing it just for you. You're doing it for your family, your future, your life. You're stronger than silence, smarter than stigma, and more powerful than any disease when you act early. Take control, stay informed, and as always, take care of yourself and those you love.